So for the patients that are watching this that are currently wearing dentures, so when they go to your practice, what other options when it comes to dental implants?
Well, after analyzing and taking the proper imaging and 3D imaging, whatever, so we place, the first step is to place 2 implants, okay, in this area, and then we have a full set of teeth that snaps in and snaps out. Okay, so there's a little movement there on the back end because you just have implants here in the front, but it's an excellent option if you're coming from a denture.
So no more adhesive with that option?
No more adhesive there, no.
But you could eat a little bit?
Oh, you can eat significantly better. You can laugh, the thing will not pop out of your mouth, but that's the first step. That will be the first step. The second step, you can put 4 implants. So 2 here, 2 a little bit behind, and now you have like a 4-legged set of teeth, right? So it's way more stable. You can bite into hardest things like, apples, burgers, pizza, corn on the cob,
and it still snaps in, snaps out.
And still snaps in and snaps out. Still a removable set of teeth.
Now you said that there can be a lot of maintenance on the snap in, snap out option. Like they have to come out with money out of their pocket maybe once a year.
Right. There's a maintenance process there because those snappers or those attachments, they wear out over time. So depending if you have 2 or if you have 4, it's average about 9 months, 8 months, you have to replace those snappers, which is easy to do, but there's a maintenance there. The teeth over time wear out too because they're composite teeth.
All right. Okay. Now, what about the upper? Same thing. Snap in, snap out.
The same thing, but on the uppers, it requires 4 at least to have that ability, just because of the bone quality and whatnot.
Okay. Next level up.
Next level up is fixed teeth. So you can do.
You mean fixed teeth meaning they don't come in and out?
They do not come in and out. The only person that can take them out is me, the dentist. Right. So the benefits of that. They can be made out of porcelain teeth, so they feel more real. They smoother. They don't really wear out.
So like on the lower, like 4 implants, 5 implants?
4 to 6 implants, depending on the situation. But yeah, with little as 4 implants, you can have full teeth in the mouth. So, and people sometimes think that they have to have one implant per tooth, which is not true. So, and that makes it significantly more affordable, by the way.
How strong are those? So if you give somebody a set of teeth that don't come in and out, supported by 4 or 5 implants, 6 implants,
that's if you want to
eat
work,
whatever you want?
If you want to work at Cirque du Soleil and bite into those things and spin around, you can. That's how strong they are.
Yeah. Really?
Yeah.
Okay. Now, what about the upper? Because the upper is pretty good, right? It has suction, the upper denture.
Right. The upper, you're talking about the upper denture, right?
Yes.
So, but you have the plastic covering the roof of your mouth, which will hinder your taste for food, temperature, everything. So you can't really taste food right. Okay. And we were talking about it. If you think your wife is a bad cook, once we convert you to a fixed teeth that has no roof of your mouth, you may be sure that she's a bad cook. Now that's a joke, but you can taste food better. You can, because
like spices and like red wine or whatever.
Oh, absolutely. You can taste like a normal human being should taste their food, and that's a basic pleasure in life is eating, right? And a lot of people socialize when they're eating, so it's a benefit.
It's a new lifestyle.
Absolutely.
To be able to eat. Now, how old can you be? So you take a denture wearer. You give them brand new teeth supported by dental implants that don't come out.
Right.
How old can you be to do this?
I mean, we have a 96-year-old that had implant done. And you're going to go...
Why would a 96-year-old do that?
I know. That's what I thought too, right? But the truth of the matter is, when I recommended something removable for her, she got offended. You
mean the snap-in, snap-out denture?
No, I was like, you're 96, so let's do something removable, no implants.
Okay.
That's what I...
Like a denture.
I prejudged her.
Okay.
And that was on me. I take that, and that I learned a lesson. You should not treat age. You should treat a person. And that's her call to make sure, or his call, or one's call, to decide what is best for them. She got offended. And I tell this story to everybody. So she got 5 implants, she has fixed teeth, and she's as happy as she could be.
So upper and lower teeth that don't come in and out.
Correct.
At 96 years old.
Well, in her case particularly, it was the uppers.
Upper, okay.
Yeah.
and she can eat whatever she wants. Can somebody bite like a carrot that's raw with their front teeth, or they have to be careful?
Well, they can. They can. We always, if there's such a common sense, if that's such a thing, we ask for it. But you basically it's a normal life.
Yeah, but what if, look, the typical 80-year-old is on like 3 or 4 medications. Can you be on some medications and still get this procedure done?
No, absolutely. If you're diabetic and you're under control, you're a candidate. If your high blood pressure is managed by the medication, you're a candidate, right? So
what about a little bit of osteoporosis? Can you do that?
You can. If you're not taking infusions over the years, you're a candidate. So if you are taking, then you have to be a little more careful, but we have to discuss in a case-by-case basis.
So you may talk to their medical doctor
Correct.
if need be.
Oh, absolutely. We do that often. If there's any concern, we're here for our patients, not for me.
So no more dentures?
Oh, please, no.
Do you think dentures in the future will be gone? That means dentures as we know them today, in the future will all be attached to something?
I think so, but it's mainly letting the community know the possibilities. A lot of the patients that comes to the office, it's been years, right? Because they're wearing the dentures, they feel like they don't need to go back to the dentist, and they come back and they say, hey, there's this option. What do you think? I was like, I never heard about it. It's like, how come? Well, nobody ever told me about that, because they're wearing dentures for 10, 20 years or more. So, and then we give that option, and some people do it, and they're like, oh my God, I can't believe that's even possible.
Do you ever do like a spouse, and then once they get it done, then then the other one does it?
Absolutely. Sometimes they say, oh, you go first.
Okay.
And then I like, the whole family is done. One thing that I say, especially on those cases, I like to say that I make the spouse jealous, okay, because they look so good, they're so more confident. That then like, man, they feel like they're getting behind. So it's kind of cool thing that happens all the time. A lot of patients that after we've done their teeth, they do the new vowels again. So it's a new life
really
that
good,
we can.
Good.
It's pretty interesting. So it's very rewarding for me to do those things.
My upper bridge failed. I visited with Dr. Roberto Macedo in his office. He told me he could build me another one of those that was better than the one I had, but he had a better idea. He could do something permanent. It has been a wow experience. Food tastes better. I am completely satisfied with the service I got from Dr. Macedo and with the results that I have.